So very handily, there's a countdown, but it seems to be starting from 10 minutes. So
Yeah. Feel free to add 5 minutes to that, or if you go over, we'll count your time.
Okay. I hope these aren't timed. So it was a very long title slide, so I'll just skip over that, and you'll get the gist of what I'm going to talk about as I go along. So first off, I'd just like to acknowledge the participation of all the people who inject drugs who generously donate their time to participate in the NESI survey, which is one of the main sources of data that underlies what I'm going to talk about today. And this is just a disclosure regarding the study funding, but they didn't have any influence over what I'm going to present today. So you'll all know a lot of this background already, but for those who don't, the UK and Scottish governments committed to eliminating hepatitis C as a public health concern by 2025. So ambitiously 5 years in advance of the WHO global target of 2030. And one of the WHO targets, well, it's in fact a proxy target for the incidence target, but it's to reduce prevalence of viremia, or chronic prevalence. I'm going to use those two terms interchangeably, by 80% from a baseline year of 2015. And this, as I said, is a proxy for the reduced incidence target from the WHO. But as somebody very handily showed this morning, Adelina on her slides shows that declines in incidence track declines in prevalence very closely. And so if you achieve the 80% prevalence target, you're quite likely to have achieved the 80% incidence target. And obviously scaling up Hep C treatment, so direct-acting antivirals, is an approach that a lot of countries are taking alongside high coverage of harm reduction interventions to achieve hepatitis C elimination. So this study is part of a bigger study called EPITOPE. And the intervention in EPITOPE is treatment as prevention. So this is the idea that you treat an individual for their infection, they don't pass it on, and there's a population benefit in terms of reducing prevalence of hepatitis C viremia. So NHS Tayside is the intervention site where rapid and major scale-up of treatment as prevention occurred. And you can see NHS Tayside on this map of the United Kingdom. It's up in Scotland. Scotland is the orange bit up at the top. And Tayside is on the east side of the country. And it started scaling up more rapidly and has now treated about 1,200 people between 2015 and 2023. And this was achieved mainly through testing and treatment in a lot of community settings. So needle exchanges, pharmacies, drug treatment sites, just making treatment as easy and accessible as possible via these community pathways. And the idea was this was a natural experiment, so it wasn't controlled in any way. And the idea was to compare changes in chronic prevalence in Tayside with other regions where the scale-up was less. But of course, in a natural experiment, you can't control necessarily what happens, and the other regions have scaled up treatment to a certain extent, but I'll go into that a bit more. So we did previously demonstrate, these data were presented at previous INSU conferences, rapid scale-up of Hep C treatment among people who inject drugs in Tayside. So the top just situates Tayside compared to other regions within the UK, and you can see that treatment intensity is cumulative treatment intensity is quite a bit better than other regions, but you can see that other regions are also scaling up treatment. And the bottom graph shows Tayside versus the rest of Scotland. So Tayside very much scaled up to a greater extent than the rest of Scotland, although you can see there's still scale up in the rest of Scotland. So in that context of increasing treatment of DAAs, we saw reductions in prevalence of hepatitis C infection, chronic hepatitis C infection. So the bottom graph shows that we saw a greater decline in Tayside relative to the other areas in Scotland, so 71% decrease in Scotland. So these data were up to roughly 2020. And the top graph is work by colleagues, which demonstrates the impact of treatment as prevention. So this shows that with increasing treatment intensity, you get greater decreases in chronic prevalence. And this was based on all UK data. So the aim of this work was to focus in on Scotland, because that's the data that we've got available at the moment, not the wider UK. So the aim was to compare Tayside with other Scottish regions, so specifically Greater Glasgow and Clyde and the rest of Scotland, and just to update on what we're seeing in terms of hepatitis C treatment uptake and see how we're doing towards going towards hepatitis C elimination, particularly in the context that there has been a COVID-19 pandemic in the interim. So the data that we use comes from the Needle Exchange Surveillance Initiative, or NESI, which is a cross-sectional survey of people who inject drugs in Scotland, recruits all across mainland Scotland. You can see the sites where we recruit at in that map on the right. Mainly recruits at sites that provide sterile injecting equipment. Some of these also provide opioid agonist therapy and other interventions. And we recruit approximately 2,000 to 2,500 per sweep. So a sweep is what we call a whole round of a survey, so how long it takes us to get all around the country. And there have been 8 sweeps going back to 2008. So the latest one that I'm updating on is the one that was undertaken in 2022-23. And notably, as I said, this is the first sweep since COVID-19, so we can see what has happened since the pandemic. So just very briefly, in NESI, participants complete an interviewer-led questionnaire. We call this, the data that comes from this, the self-report data. They also provide a blood spot sample, and these samples are tested for HCV, as well as Hep C. And then we link this back to an individual's self-report data via unique identifying number. So we link that all up and analyze it. So the way we analyzed it is what I've first just called a crude analysis, which is basically just based on raw NESI data, looking at the percent that report getting treated for their hepatitis C, either ever or in the last year, and looking at the dried blood spots and calculating from these the proportion that test RNA positive out of the total and the proportion that test RNA positive out of the antibody positives. And we also use this NESI data to update a model that had previously been done for Scotland. So this is my colleague, Pantelis, updated this model, bringing it up to date with the 2022-23 NESI data. And this model is focused on an intervention, which is the scale-up of treatment starting in 2015. And it's a Bayesian hierarchical model. But basically what it does is fits a model to the data pre-2015, extends this into the future to predict what we would have seen in the absence of any scale-up of DAAs, and then fits a separate model to the data post-2015 to see what the trends were under the intervention scenario. And we also use this to assess progress to elimination by comparing the most recent estimates to those from 2015, which is the WHO baseline year. So moving very quickly on to the results, this is looking at the uptake of self-reported therapy from the NESI study. So you can see ever treatment is going up across all the regions, but I'll focus here on last year treatment. So you can see there's perhaps a slight decline in the intensity of treatment in Tayside, going from 53% down to 42%. Greater Glasgow and Clyde stayed approximately the same, and there was a slight increase in the rest of Scotland from 24% up to 37%. So apart from the rest of Scotland, these other areas perhaps not maintaining the same upward trend that we had seen pre-COVID. And just very briefly looking at where people report starting their hepatitis C therapy. So as I said at the start, the community pathways approach was a key to scaling up DAAs in Tayside, which is over on the left there. And you can see in the green that those who start their treatment in community are still very much in the majority in Tayside, but to a lesser extent in the other areas. And so looking at the results of the dried blood spots from NESI, interestingly, we see in the context of perhaps not maintaining the same level of treatment intensity, we nevertheless see a further decline in Tayside. So it's now down to 4% in the latest sweep in 2022-23. So this constitutes an 88% decrease relative to the baseline year of 2015, which would which would suggest, I think something fell down the stairs, which would suggest that Tayside has potentially reached the 80% WHO target. Perhaps some evidence of a plateauing in the other areas, so Greater Glasgow and Clyde, only a few percentage points decline, and similar with the rest of Scotland over the last 2 surveys, so potentially reflecting less treatment during COVID-19. But nevertheless, still good progress in those areas since 2015. And this slide is effectively showing the same as the last slide. It's just the denominator here is antibody positive. So this is viremia among those who are antibody positive. Essentially showing the same thing, larger decline in Tayside, which does suggest that it has reached or exceeded perhaps even the 80% threshold for the WHO. So these are the modeled results. And these are trends in viremia among people who also are HCV antibody positive. So the black asterisks represent the observed prevalence that we've seen in NESE. The gray bands represent the counterfactual, so this is the estimated prevalence that would have occurred in the absence of any DAA scale-up. And the colored bands on each of the graphs show the estimated trends under the intervention scenario for all the different regions. So similar to what the raw NESE data is showing, looks like you can see here a substantial difference between the counterfactual and the estimated prevalence under intervention in all of the areas, particularly in Tayside. And then finally, based on the modeling, Pentel has calculated the relative reduction in prevalence. So this is the reduction compared to 2015. So relative percent reduction compared to 2015 is along the x-axis, and the probability of having achieved this reduction is along the y-axis. So the dashed lines are what we want to focus on here because those are the updated estimates, and in particular the green dashed line, which is Tayside. And what this shows is where it intersects the 80% reduction threshold. So there's a 70% or greater than 70%, in fact 71% probability that Tayside has achieved an 80% reduction in chronic prevalence. So that, so in essence, quite a good probability that has achieved the WHO chronic prevalence target. And you can see the other lines for Greater Glasgow and Clyde and rest of Scotland don't quite cross the 80% threshold, suggesting that it's unlikely that they've achieved this target, but you can still see that progress has been made there. So just to summarize, despite the COVID-19 pandemic, chronic hep C prevalence has continued to decline in Tayside, and evidence from modeling suggests that the early WHO target of an 80% reduction in HCV prevalence relative to 2015 has been achieved in Tayside. Other regions, however, are also making good progress towards the target. And also evidence from the modeling that reduction in chronic hepatitis C is associated with scale-up of hep C treatment in the community through pathways targeting people who inject drugs. And that's just a few acknowledgements. There we go. Questions?
Thank you, Norah. We probably have time for 1 or 2 questions. There doesn't seem to be any questions online. So does anybody have any questions they want to ask? Could people hear that? Do you want to?
Could you bring sorry, does anybody have the mic in the room? If you could bring the mic down to the front.
Yeah,
Where?
Here.
Sorry, I thought you were going to repeat from the podium. So I remembered a certain round of the excellent data from Tayside that there was a higher than anticipated reinfection rate, particularly because they'd pushed in some very high-risk community groups with that excellent work. So how would that reinfection rate at various strata impact your modeling results in terms of whether you're hitting or not your targets?
The reinfection work I presented on, it was a colleague's work, and it showed an increase initially. So in Tayside, the reinfection went up and then it declined, but it will be incorporated in the model. Reinfection isn't directly incorporated, but it will be taken into account because it will be reinfections will be counted in chronic prevalence. If you see what I'm saying, so incident, reinfection, whatever it is, will all count towards chronic prevalence. So it incorporates all of that.
One very quick question.
Yes, quick question. Simon, I'm from Gothenburg, Sweden. We had an issue in addiction units, especially needle exchanges, of the testing rates going down during the COVID-19 pandemic, and I'm not sure they are back on pre-pandemic levels. Do you know the situation in Scotland?
So a colleague did some work, it's probably a couple of years ago now, but it was looking at how some of these interventions changed. And certainly during the COVID-19 pandemic, bloodborne virus testing essentially fell off a cliff. It has recovered to a certain extent. There's been quite a bit of recovery, but probably not to pre-pandemic levels. So there's, still work to do.